Data from the National Child Traumatic Stress Network report that 1 out of 4 children will experience a traumatic episode within their life. These traumatic events, we know, have a profound effect upon children. They affect those children in the forms of emotional distress, physical distress. They impact their ability to learn in school and their functioning and interactions. My clinical practice is an integrated behavioral health approach, and in this approach, we look at both the mental health and the physical health. The traumatized child may experience physical symptoms such as headaches and stomach aches, poor control of their emotions. Also, that child may exhibit difficulty in their academic performance, unpredictable behavior. That child may be underreacting to external stimulus or overreacting to external stimulus. Children who have experienced trauma, we find, will have intense reactions to reminders of the specific traumatic event that has occurred. We see children sometimes that if they think that they're being violated, maybe in their personal space, they tend to react and have a reactive behavior as a result of that. Additionally, we find sometimes in the school setting, these children are fighting. They're not getting along well with their peers, especially if they feel violated or if they're teased by others. The traumatized child may exhibit resistance to change and transition. In regards to school, the lowering of the GPA, school absences, tardies, and an increased dropout rate is some of the things that we see with children who have experienced trauma. A child who has had traumatic experiences earlier on in their life may have adverse impact in attention, memory, and focus. This child may have difficulty focusing, organizing, and processing information. The child may also have difficulty with effective problem solving and planning. This also can result in feeling overwhelmed, anxiety, and depression. Adverse childhood events, known as ACEs, we know impacts children beyond the present moment. We know that the trauma impacts the child long after that traumatic experience has occurred. I think it's important that we know how trauma impacts that child at the present moment and in the future. It's important that we know the difference between a reactive child to trauma and a child who has behavior problems. I think when we understand a child is being reactive behaviorally as a result of trauma, it changes the way that we would approach that child. I think it's important that we know the difference between those behaviors and the behavior of a child who may be diagnosed with ADHD. Definitely not getting those confused. We can help a child with trauma by knowing the signs of trauma, understanding the difference again between reactive behaviors, trauma, and the child with behavior problems. It's important, I think, to talk to the child, but it's mostly important to listen to that child who's having reactive behaviors as a result of trauma. Listen to their story. It's important that we observe. I think it's also important that we listen to what they're not saying. Another thing we can do to help the child with trauma is to follow our school's reporting procedures. If we suspect that a child is experiencing a trauma, work with the child's caregiver and the school setting. Look for resources that may be available in the community to the child. Be quick to refer the child to services outside of the home, outside of the school. Refer to community services when the child is showing difficulty with coping. Trauma impacts children in several areas of their life. But what we do know is that there is help for children who has had traumatic events. We know that there are services available within the community where children can receive counseling services that can benefit and improve behaviors that are a direct result from the traumatic experience.